Javier Acosta. I'm the administrator of physical therapy services. We have a clinic in the Heart Side area on the 6th floor. We also have an outpatient in the new building in Drinkard. So if there's anything that you guys need pertaining to balance, strengthening, just general conditioning, you can come and see us and we can take care of it for you guys. So this is probably the third series in our fall series that we've done. We've covered what to do when you fall. We've covered what to do once you fall, where to go to. I wanted to do something a little different. Let me grab a chair. One of the things about falls, it's part of life, but it's not a natural part of life. It's not, say, by the time you get to be 60 years old, gosh, I'm going to start falling once a week. It doesn't work that way. Falling is not natural. When you fall, that means there's deficiencies. You either have balance deficiencies or there's awareness deficiencies, postural deficiencies. Something is going on, straight deficiencies. Something is going on that's causing the fall. It just doesn't come out of the blue. And it's normally a progression. That means it just doesn't happen overnight, what they call an insidious onset. It doesn't happen that way. I have a patient that I'm seeing right now, and she fell. So when the family member talked to me, they said, how did it happen that she fell overnight? Well, she had swelling in her legs about this much, pitted edema, and it's 15 years worth. So it's taken her 15 years to get to that point, and she fell. So it normally accumulates over time. Human beings have a tendency to put things off if we can hide it. If we can hide it underneath our clothing or here, if there's a big mole on top of your head, trust me, you will go to the doctor instantaneously to get it fixed. But if you can cover it underneath shirt or slacks, you're going to let it slide. That's the dangerous part, because those kind of deficiencies can cause a problem. So how do we prevent falling? You can't really. Can you prepare for the prevention of falling? Of course you can. So as humans, we need to keep our bodies as strong as possible. So core tissues that we're going to look at today, and these are muscles that we use when we get off the floor, because that's what we've been talking about. When you fall, what do you do to help yourself? Do you lay there? We had a patient that laid on the floor for 20 hours. She was in independent living. No one knew she was there. We had another patient laid on the floor for 4 hours. No one knew she was there. These things are not common, because if they don't call for help, if they don't have a pendant, or if the pendant's not on them, no one's going to know. It's like actually looking in the cottages. Someone falls out there, no one's going to check on them. That's independent living. So unless you call for help or do something on your own, you're going to be there for quite some time. So that's what we always talk about. You want to make sure you have your pendant on you, not on your wheelchair, not in your walker, but on your person. If you don't have the pendant light, have a cell phone with you in your pocket that has direct access to the front office. So you just hit it and it goes out automatically there. If you fall, we've talked about this before. If you've fallen, are you okay? No, you're not. You might think you're okay, but 90% of the time when you've fallen, you're in a trauma. Adrenaline is kicking in. Trust me, you are not okay. So if you fall, do not tell the person at the front desk, I'm okay, take your time. That is not the case. We had a patient who fell, hit his head. 2 days later, he ended up in the hospital. These things can come on. You can get slow bleeds. You can have a fracture, not know it. There's so much swelling, you don't feel it. 24 to 48 hours later, the swelling decreases and you start feeling pain. There was a famous cross worker or a CrossFitter. She broke her neck. She did not know she broke her neck. She was in a competition lifting over her head and she got dizzy and fell. The weight hit her in the back of the shoulder, broke her shoulder. They thought, gosh, maybe her blood pressure went down or something like that. No, she was competing for 2 days with a broken neck. Had no idea. The swelling decreased to the point that it impinged the nerves and she went down. She was in a neck collar for probably about 6 months. She's competing now like if nothing. But so technically when something happened, a trauma happens to you, you're not okay. So you have to ask for help. So getting back to what we do, when we fall, what muscles do you think we have to implement? Just throw them out loud. Do you think it's important that your stomach is strong? Of course it is. Do you think it's important that your shoulders and your arms are strong? Yes. You think it's important that your legs are strong? Yes. So we're going to look at all these. These are things that you can do either seated or standing. So how many of you can stand and keep your balance pretty good? Okay, good. So the ones that can stand, I want you to stand up for me. And the ones that want to stay seated, you can stay seated. Okay? So now, when you're standing, we're going to start from the floor. Okay? What I want you to do is I want you to stand, and I want you to stand behind your chair so you're able to hold onto your chair for balance. So I'm going to turn sideways so you can see me and the camera can see what I'm doing. Okay? If you don't have a chair available, use a counter, use a wall, and I'll show you how to do that too. We're going to go after your calves and your ankles first. These are the muscles down here. Okay, if we wanted to get technical about it, this muscle is called your tibialis anterior, and this muscle is called your gastrocnemius. Now, why is that so important? They're the natural pumps of the body. That means they grab the fluid from your foot and shove it back into your system. As we get older, circulation does not get better, it gets worse. I'm 60 years old, and if I know that I'm not going to be treating that day or talking to you guys and moving around, if I'm sitting at my desk doing paperwork, I wear compression socks. Do I have circulation issues? No. But by the end of the day, my feet are going to swell a little bit. I don't want that to continue to happen. Swelling can cause cellular damage, so you want to make sure you're staying away from it. So you want to move as much as you possibly can. If you're the type of person that sits all day long and watches TV all day long, fine, if that's what you want to do. Every time there's a commercial, get up and walk around a little bit. Sit down, watch your show, get up and walk around a little bit. So if there's 5 commercials, you should have gotten up 5 times. How far you want to walk is up to you. But the main objective is that you move every day. Do a little bit of something. So calves. There's 2 ways to hit your calves. If I come up on the tips of my toes, it's going to hit this big muscle here. That's your gastrocnemius. That muscle is responsible for pushing my toes downward. So why is that important? Because when I'm walking, if I do a heel strike, as I come forward and I'm getting ready to accelerate and push forward, that calf muscle pushes my toe, so it drives my leg to drive and take a step. If your calf muscles are weak, what do you think is going to happen? You're going to fall. Because it's the first point of contact when you hit the ground. So there's an old saying in therapy, once your foot hits the ground, everything changes. So if you keep your calf muscles strong, we're going to do this in standing and in seated. If you keep your calf muscles strong, the better your circulation, the better your sensation to your feet. The bottom part of your foot is really important. If you have swelling, do you think you're going to be able to feel the ground? No, you're not. Okay, it's like wearing 20 pairs of socks. It doesn't work that way. So what happens, you have what they call proprioceptors on the bottom of your feet. The more you're able to feel the ground, the better your balance is going to be. The better your circulation, the more sensation you're going to get. So what I would do during the course of the day, how many of you guys are early risers? You guys get up at 6 or 7? How many sleep in until about 10 or 11? How many sleep in until about 4 or 5? How many don't wake up at all? Okay. So if you're, I like to exercise in the morning because I like to get it out of the way, and then I exercise again in the evening. It just helps me de-stress. Okay. If you're an early riser, you want to do this as soon as you get up. It's going to help increase your circulation. So we're going to do this simply. You go out to the kitchen, you drink 2 glasses of water, unless the doctor has restricted you. I want to make sure it's perfectly clear. Unless the doctor has restricted you on fluids, you need to drink 2 glasses of water in the morning first thing. Why? Because you're dehydrated. You've been sleeping for 8 to 10 hours. Your body will not function unless it's hydrated. So you're losing a lot of water with sweat during the course of the evening, okay? And so you need to hydrate yourself. If you do not hydrate yourself, you're not going to feel good. Coffee is not a hydrator. It dehydrates you. Tea dehydrates you. Orange juice, milk, these are all fluids, but they're not water. 2 glasses of water instantaneously. Force yourself if you have to, okay? Then you start your day. So you go to the counter, you've drank your water, you sit there and you stand holding onto the counter, and you're going to lift up through the toes. Then drop the heels down. Lift up to the toes and drop the heels down. Now, I want you guys to do that 5 times for me. Ready? Do it at your own leisure. How many feel the back of your calf squeeze? Does everybody feel it? Okay, now you're going to do something a little different. That back of the calf, what I want you to do is picture in your head, I want you to picture an orange. And I want you to picture you grabbing the orange and squeezing the orange as hard as you can and trying to get as much juice out of that orange as you possibly can. That's your calf. You want to contract the muscle to its fullest. So as you come up, I want you to picture that orange, and I really want you to squeeze that calf muscle. Hold it and then come down. How long do you hold it? For 1/100 of a second. You're going to do 5 sets of 5. It's real simple. It takes less than a minute. Okay? The second one, you're going to sit in the chair, come around this way, and you're going to sit down. Now you're asking me, why can't I do this when standing up? It's a little different when you're shifting your weight through your heels. This one now, you're sitting down, you're either drinking your coffee, reading the newspaper, having cereal, toast, whatever you do in the morning, and you're going to tap your toes. Now if you do that about 20 times, you're going to feel a burn right here in the front of the calf. That muscle is actually sheared and it actually goes right to the bone. So when people get shin splints, that muscle pulls away from the shin. Okay, the main objective is that muscle pulls your toe up. Why is that important? When I'm walking and I heel strike, what happens to my toe? My toe is pulled up. Have you ever heard of drop foot? People walk like this. The reason why is that that muscle's gotten weak, the nerve's not feeding it anymore, and the foot drops. You're going to fall. Okay, so by working that muscle, you're activating the nerve structures, and that's going to help keep those tissues healthy. So now you're sitting down. You just worked your calf muscles. You're feeling wonderful about yourself. Okay, now we're sitting in that position. You got plenty of space underneath the table, so now we're going to go after the bigger muscle. We're going to go above the knee joint, which is called your quadricep. This is called an open chain exercise. Why? Because I'm moving my leg away from my body. So all I'm doing is just kicking the leg straight out. Now this is really important. If you can't go like this, then do this. If you can't do that, then do this. Okay? Everybody has a different range of motion. Go within the range that you can go. Now you sit there and say, Ben, if I go out, it really kills my knee. Then go smaller. Try to stay within that zone that's causing no pain. As the knee starts to lubricate, the joint movement will move a little better. Now, if you sit for long periods of time, let's see if mine does it. No, it doesn't do it right now. If you sit for long periods of time, your kneecap goes, you ever hear that? The reason why is because as we get older, I'm 60 years old now, the kneecap, the bottom portion of the surface is changing. If you were to look at your kneecap has this concave area and this convex area, okay? There's a little portion of cartilage underneath it, so it helps it glide right in that little groove of your kneecap. As you get older, that kneecap rides on top of your condyle, on top of the bone. So when I extend the leg out, the kneecap shoots right down to that groove. Don't freak out. It's just part of aging. How do you keep that from happening more frequently? Strengthen your quads. Say, for instance, you're sitting there and you're going, gosh, I don't like doing this, it's boring. Guess what? You have this huge, beautiful gym downstairs that has bicycles. Bicycles are a great way to work. It works on a symmetrical system just like this. It works your quadricep muscles. It helps your heart, the whole bit. Now, I'm going to be really honest. How many take advantage of the Wellness Center? 2 people. Okay? The other 4 take advantage of it. You guys are paying for it and you're not using it. It's like paying for a ticket to the movie and never going. Why pay for it? Take advantage of it. Denise is down there. They'll help you guys, they'll get you guys situated on a program. You guys want to take advantage of the things you have. You guys are encapsulated here. You guys literally have everything at your disposal. That's beautiful. You have an indoor pool and indoor gym. They've gone to no expense to provide for you guys. Utilize it. It's going to keep you healthy. Now, you're saying, gosh, but I'm 98 years old, I can't exercise. That's not true. There's a power lifter who is 98 years old, female here. She holds four world powerlifting records. Guess when she started lifting? 96. So there's no excuse for you not to do anything. Now, do I expect you to do that? No, of course not. But just a little bit every day helps. Walking, sitting, standing, moving, going down to the Wellness Center, getting on the bicycle, getting on the new step. Do something, and that's going to help you get stronger. Now, I'm going to be really honest with all of you. The first 6 weeks are going to be terrible. It takes 6 weeks for your body to adapt to emotion. So what's going to happen is during that 6 weeks, guess what's going to be your worst enemy? Your brain. It's going to lie to you. It's going to tell you, I hurt, I'm sore, I'm not getting any better, you're making me worse. If everybody were to hold do this, hold on to your forearm for me. Extend your arm out. I want you to move your fingers for me. Can you feel your muscles and your forearms move? Does everybody feel that? Okay, I want you to stop for a second. I want you to do the same thing, but this time just move your fingers slowly and tell me if you feel anything. Do you feel the muscles activate, but not that much? Now this time do it fast. Do you feel it activate more? The faster the motion, the harder the motion, the more muscle you activate. The more muscle you activate, the body does not like it because it requires energy. If I do this all day long, I'm still moving, but my muscles are still getting fed, but they're not getting fed to their maximum. Okay, our bodies are inherently lazy. They do not want to change. You have to force your body to change. So the question is, how bad do you want to stay healthy? No one's going to force you. You have to make the effort. Because if you don't, you're going to fall and you're going to hurt yourself. You're going to break a bone. As you get older, do your bones get more brittle or do they get stronger? They get more brittle, of course. Our bodies get dry. So if you fall, there's a large chance, over 80%, that you're going to break a bone. So you want to make sure you keep yourselves healthy. So we went to leg extensions, so you're just kicking straight out. Same thing with this one, 5 sets of 5. All we're trying to do is lubricate the joints to keep the muscles pliable. Okay, so now we're going to move at the chain of command. What's the biggest muscle that you sit on? Your cheeks. Okay, it's the biggest and the strongest muscle we have. The main objective of that is because that muscle is really important because the way it attaches to your hips and your back. So you're just going to sit there, step away from the back of the chair a little bit, put your hands there, and all I want you doing is squeezing your cheeks together and relax. Okay, so I'm going to help you visualize something, okay? Please forgive me because it's going to sound a little gross, but I'm going to be honest with you, okay? How many of you guys have been in a party once and you have to pass gas and you hold it really tight? And you're trying to get out of the room before that happens. So you're squeezing your cheeks real tight, right? That's exactly what you're doing. Squeeze your cheeks real tight and relax. You notice that your body shifts up a little bit. The reason why is that it's going to pull on your back muscles and compress your gluteal together. That muscle is the most important muscle you have in your body other than your heart. The reason why is that it does so much. It literally kicks your leg back. It helps with stabilization of the hip. It helps stabilize your back. If this muscle weakens, what happens, your body automatically rotates and you start walking like this. You've seen people with flat butts? Their bodies are in saber stance like this. 90% of the time, if your gluteal is weak, your back is going to be weak. If your back's going to be weak, your stomach's going to be weak. If your stomach's going to be weak, you're going to get respiratory problems and you're going to fall and hurt yourself. So you need to keep this tissue strong. So just by sitting there and doing gluteal squeezes, you're going to contract that muscle fiber. Okay, the next exercise is going to be a little harder. So now we've gone from the calves to your quads to your gluteal. So now we're going to do a little more. So now what we're going to do is you're going to put your hands on the rail of the chair. Okay? If you can stand up completely, do a complete stand up. If you cannot, do a partial. So we're going to do both. So I want you to try to stand, lean your weight forward and push up. And as you come up, I want you to squeeze your cheeks together. And then relax them and then sit back down again. Do that 5 times. Sit. You can use the rails of the chair. Come up and tighten your gluteals. So what's going to happen is, as soon as I go into flexion with my gluteals here, it's going to extend my body forward a little, but that's okay, let that happen. And then relax your gluteals. You should feel a release in your hips. Okay? Perfect. How many are you going to do again? 5 sets of 5. You're going to be doing this every day, Monday through Sundays. Now, there's something called overtraining. Trust me, you are not overtraining. The only ones that really, out of the sports world, that really overtrain are pretty much triathletes because they're doing 3 types of exercises and they're moving constantly. Bodybuilders, even if they work out 4 hours a day, they are still not overtraining. So that misconception that if you exercise every day, you're going to overtrain, it's not true. Your body's going to get toned, it's going to get stronger, and it's going to start tapping into receptors to make your body aware of what's going on. Because in reality, how many times a day do we do this? All day long. Our bodies are designed to do this. How many times when you were walking did you push through your toe and lift your heel? All day long. So you're not going to overtrain, trust me, okay? So we've gone from your calves, your quads, and your gluteal. Now we're going to go to one of the most important muscles as well, is your tummy, your stomach, okay? I have 5 hernias. That's the reason I look sort of like I'm pregnant. That's not going to go away because they're not going to do surgery on it. But I have to keep my stomach as strong as I possibly can because if I don't, I'm going to be in a lot of trouble. My stomach's going to rip open. So the main objective is I got to keep the muscles underneath that portion and keep the tissues as strong as I can do it. I can't do crunches, I can't do squats, and I can't do any kind of deadlifts. but I can still work my muscle in a seated position, in a standing position. So what we're going to do is we're going to step away from the chair just a little bit at the edge. And I want you to put your hands on your belly button. I want you to think about your belly button pushing to the middle part of your spine. So think about sucking your stomach in. Do you feel that? And I want you to hold it. But don't hold your breath. So you're not sitting there going, oh, okay, I'll hold it for 10 seconds now, starting counting. You're going to pass out on me. Pull your stomach in to where you feel it pull in and hold it. 5 seconds. But breathe. Count. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. By counting, it's going to make you inhale and exhale. As you get stronger, that stomach vacuum is going to intense. So remember Arnold Schwarzenegger when he was younger and he would put his arms up and he would concave his stomach in? The reason he did it, he had a very wide waist. So by sucking his stomach in, it's called stomach vacuuming, he would shrink his waist to nothing. So it would make him look 4 times bigger than he was. It was all an illusion, but that's exactly what bodybuilding is. It's an illusion. So the main objective is to try to get your stomach to sunk in as much as possible. The more you do it, the easier it's going to get. The great thing about this exercise, you can do it sitting on your back when you're in bed, and you can also do it standing. The standing one's a little more active, which is kind of cool because we're going to activate different muscles. Okay, so what I want you guys to do is, can you guys all go to that wall for me? Or whoever can. If not, I'll show you how to do it seated. But for the ones who stand, can go to the wall. And the ones who stay seated, stay right there. So you're going to put your backs against the wall for me. I want you to feel your cheek against the wall and your back against the wall. Okay? I want you to put your hands on your hips. And we'll get to you in a second, sweetie. Okay? Now I want you to bend your knees a little bit and separate your feet at least shoulder width. Okay, the muscle that you're going after is called the TVA. It stands for Transverse Abdominal Muscle. Well, now, why is that so important? That muscle for everyone, male and female, small adults, it's what they call a postural muscle. It's designed to keep you upright. That stomach vacuuming that you're doing, that's the muscle that activates. So what you're going to do now, the reason I have you against the wall, is you're going to be sitting here like this, and I want you to bend your body forward a little bit, keeping those knees slightly bent. Now, why am I having you bend forward? Because it's going to help you activate that muscle a little more. That muscle is a flexor. That means it bends you forward. So just by bending a little bit, you should feel now your low back sort of flatten into the wall. That's going to give you tactile feedback. It's going to let you know that you're doing it correctly. So if we break it down, you're just going to move your shoulders away from the wall a little bit. From there, I want you to suck your stomach in. You feel that? Now, you're going to take 2 steps to the left, keeping that stomach in, and 2 steps to the right. You're going to do that 5 times. Left and right is 1. You ready? Pull that stomach in and go. And then I'm going to use you as an example to do it seated. Do you feel that in your stomach? Try to go against the wall as much as you can. Really pull that stomach in, bend forward a little bit, and just sidestep. The reason it activates your stomach is because as soon as you activate your legs and go laterally, guess what it's hitting? Your love handles. These muscles tie into the pelvis area here. Those muscles rotate your tissue, they laterally flex you, and they bend you forward. So those muscles are crucial to hit. So now we're going to use her as an example. And I'm going to sit sideways so you can see me. If you can't do it standing because you feel uncomfortable and you feel like you're going to lose your balance, we're going to do this together. Okay. So what you're going to do is step away from the back of the chair, put your hands on your waist, and you're going to bend your body forward a little bit. Now you're going to put your feet together, and you're going to step out, step in, step in. Suck that stomach in. Step out, step in, step in. Step out, step in, step in. Step out, step in, step in. So if you can't do it standing, you can still do it seated. The only difference is when you're seated, your flexion is going to be a little more extensive, and you're going to be able to pull in your stomach a little more. Okay. If you're in bed and you're laying down, so I'm in bed, I'm laying on my back, I'm here. I'm going to get my stomach, and I'm going to put it right on my tummy. And I'm going to pull my stomach in. You should feel your chest elevate. If you can't get the contraction, put one hand behind your head. You should feel your rib cage, then pull your stomach in. You'll feel more of a contraction that way. That muscle is to be worked every day, okay? You can do these in the morning, you can do these in the afternoon, you can do them in the morning, midday, and the evening if you want to. But your TVA muscle is one of the most important muscles that you're after. Okay, unless the doctor has limited you on rotation, that means turning your body, is the next exercise that we're going to be doing. So does anybody have any back problems? The doctor said you can't do any kind of turns? Everybody's okay? Okay, so you're going to come back and sit down for me. Am I confusing anybody? Is everybody okay? Okay, the next muscle that complements your TVA is called the multifidus. Okay, these muscles are the ones that attach on your spinal cord. So I want you to visualize a Christmas tree. It's the easiest thing to think about. So a Christmas tree looks like this, right? That's how the muscle looks. So it literally goes from your coccyx bone, which is your tailbone, and it goes like this, all the way up your spinal cord. That muscle is important because what it does, it actually is a postural muscle as well. It helps stabilize your spinal cord, and it helps you with your movement. So all we do with this one is you put your hands across your chest, just like this. Your motion is going to be real small. Now, everybody's rotation is different. Some people have really big rotation, some people have real small rotation. So this is the important part. I want you guys to turn your body left and right and tell me what side is tighter for you and what side is a little more loose. If they're the same, the motion left and right is going to be the same. If the motion is smaller on one side than the other, your body's always going to go to the small side. So let me explain this. So if I'm turning to my left and my left side is my tightest because of the hernias, if my left side is going to be the tightest one and my right one has more rotation, I'm going to dictate to this side. So that means my right is going to move just like my left. So I'm just going to go like 15 degrees. That's it. Why? Because I want the muscles to fire equally on both sides. How many sets are you doing on this one? 5 of 5. Left, middle, and right is 1. None of these things should cause you any pain. Now, if the muscle is really sore, or I should say really weak, are you going to get sore? Of course you are, because the muscle hasn't been activated. I had a woman that was seen in outpatient, and I had her sit there and do this TVA muscle that I showed you how to do. Bend forward and pull your stomach in. And first she goes, it's not doing anything. I go, trust me. I go, in 4 hours, you're not going to like me very much. Guess what happened? In 4 hours, she called me. She didn't like me very much. She goes, Ben, I'm sore in my stomach and sore in my back. I go, because you're activating those muscle fibers. As she leaned forward, her extensor had to hold her there, which is her low back muscle, and then she had to activate her stomach muscle. Those tissues from her groin all the way from her obliques and her backs had to fire to sustain her. She did it for about 4 or 5 days, and the discomfort went away, but now she was able to get better contraction in her stomach. Okay, so those things are really important. So we've gone from your calves, your quads, your gluteal, and your stomach. Now we're going to work on your back muscle. Your back muscle is a really easy one to play with. What you're going to do is sit a little farther forward. Now this time you're not going to activate your tummy. You're going to let your stomach just relax, but you're going to sit up nice and straight. You're going to get your hands and you're going to bring them past your knee joint. Okay, just like that. You're going to allow your body to slide forward. Everybody's flexion going forward is different. Don't push it and don't bounce it. Your feet should be right underneath your knees, and you're just going to keep your head straight. So watch what's going to happen to me. I'm going to slide forward, stop, and come right back. Now when I come back, my shoulders are going to be even with my hips. So I'm going to be like this and come right back to where I start. I'm not going to start back here, and I'm not going to start here. I'm going to be nice and straight, and I'm just going to go small motion forward. Keep my head looking straight at the same angle that I'm looking at. Because I'm not after my stomach muscle, even though my stomach muscle is engaging forward, I'm after my extensor muscle, which is my low back muscle. Because what happens when I bend forward, what comes into play? This muscle does, right? But when I go back, what's the muscle that has to return me? My back muscle. And that's what I'm after. So as I pull back, I'm allowing my body to work. So that's going to be your extensor. That's going to keep your body upright. So we've gone from your calves, your quads, your gluteal, your stomach, and your back. So now we're going to be looking at your chest, your shoulders, your arms. Okay? Now, 75% of your body is this big beefy muscle right here. It's called your tricep. The reason it's called the tricep, it has 3 heads. You have your lateral head, You have your long head. The long head goes from here, it attaches, and it attaches back up here. And then you have the smaller muscle portion right here. It's a stabilizer. You normally don't see it. In TV, when you see people flex their arm, it looks like a horseshoe, or like the Star Trek logo. It looks like a little horseshoe this way, okay? The easiest way to hit that is by actually pressing up. That's what it does. It's an extensor. It actually either moves my elbow forward this way, and if you put your hand here, you can contract it. As we get older and you put your arm in, what happens to the back of your arm? It goes, whew. It flaps in the wind, right? Some people, you can stand next to them, and if it's really loose, they're gonna slap you every time they move their arm. You don't want that to happen. Okay, and it's really not the muscle. You know what it is? It's just fatty tissue surrounding the muscle. If a bodybuilder were to stop exercising, he's gonna get out of shape. A lot of people think that muscle converts into fat. It's not the way it works. I want you to envision a coin that's sitting there, and then I cover it by sand. The coin's still there, it's just covered by the sand. So what happens with us humans, our muscles get smaller and we get covered by fatty tissue. The more muscle you have, the more efficient your body is at burning calories, because it requires more because of the muscle fiber. So the muscle is more efficient at utilizing your body's nutrients than fatty tissue, okay? So from here, all you're gonna do is put your hands on the rail of the chair, keep your feet flat on the floor, and now if you can't do this, we're gonna give you another exercise. And all you have to do is press up and then down. Now, when you press up, you're just gonna go to the extent of your arm. That's all you're doing. So you're just pressing up and then down. Pressing up and then down. Now, people that have bad elbows, some people get tennis elbows, and if they extend out, it really hurts on the condyle. There's no big deal, we can take care of that. So this time you're gonna sit in the back of the chair, back is nice and flat. You're gonna bring your arms up, just like this. You're gonna keep those elbows into the body. You're gonna make two fists, keep your wrist straight. All you're gonna do is extend out and back, out and back. When you extend out, you should squeeze the back of the arm. Do you feel that back there? But you gotta keep those elbows up, because as soon as you start bringing the elbows down, your shoulder is going to come into play. So keep those arms there and just actually come straight out. Okay, how many are you doing? 5 of 5. Now, Ben's going, gosh, we have to do 5 of 5 on all these exercises. I'm going to be in my room exercising for 7 hours. You don't have to do it that way. You can do 1 exercise per day if you want. Okay, there's 7 days a week. That's fine. You can do 2 exercises a day. You can break up 2 exercises in the morning, 2 in the afternoon, 2 in the afternoon. It doesn't make a difference how you break it down. The most important thing is that you what? You move. Okay, how you break them down, if you can only do 2 sets of 5, that's great. Work up to the 5 sets of 5. The main objectives, you have to have a goal, you got to keep track of it, and that's how you move. I keep a journal on everything, literally. It drives my wife absolutely nuts, because I have journals that I've kept for 10 years. But the main objective is I put down how many repetitions I'm doing, if I'm cycling, doing whatever. It helps me keep track. So if for some reason something happens, that my strength isn't going up, I'm not losing weight, I'm not stabilizing, I can go back and say, it's because you took 2 weeks off here. Okay, so I get an idea of what's going on. It helps you keep track. For human beings, we need to see something to be activated. It also gives you a goal. So say, for instance, you want to be able to walk a mile, and you can only walk a quarter of a mile, and your goal is to try to get there in 3 weeks. Set it at the 3-week mark and see where you are to that goal. You might surpass it, or you might be slightly shy, and just move the goal over. If not, you increase it. It just gives you something to aim for. So we've gone from your calves, your quads, your gluteals, your stomach, your back, and your triceps, 75% of the arm. Now we're gonna work your bicep. Your bicep's a really cool muscle. The reason they call it bi is because it only has 2 heads, okay? So now your bicep is responsible. Its main purpose in reality is to turn your hand. It's a supinator. That's what it's designed to do. If you were to put your hand here and turn it, you'll hear it flex. You'll feel it move. Your bicep also helps lift your shoulder up. It activates with that arm. You can actually feel it come in because it attaches right on top here, okay? So the main objective is that you just hit it straight off. So keep your arms here like this. I like to do curls 2 ways. I either keep my palms slightly outward, or I keep my hands in hammer curls. It's still gonna hit the same bicep head, just different angle. So what I want you to do from there is keep your elbows close. Now this is really important. You have to keep your elbows close to your body. You can't slouch on this. As soon as you slouch, your pectoral muscle, your chest muscle, and the front of your shoulder is gonna come into play. This shoulder is a really small muscle, and it causes super problems because it wants to engage every single time. And you see those bodybuilders will have this huge shoulder right here, and they end up developing, they rip their pec eventually because the shoulder's too dominant. So you want to keep your shoulders back and down. So now you're just isolating your bicep head. And all you're doing is just a small curl. Now as you come up, you should squeeze that arm. You should feel it squeeze. So you should feel it squeeze from your forearm to your bicep. So you're just holding it for like 1/100th of a second. Squeeze. Can you use resistance with this? Of course you can. Now, there's a lot of saying that as you want to get stronger, I don't want to build mass, I don't want to build bulk, I want to just cut up. You can cut up with heavy weight or lightweight. It's just what the muscle is doing. You're either overloading it or you're increasing the repetitions. So you can actually just go by your hands and just curl this way and you'll get a contraction. Now, if you want to get more of a contraction, it's going to depend on your wrist. So if I were to curl my hand, remember I said that my bicep is responsible for turning my wrist. Well, these forearm muscles right here, this brachioradialis muscle right here, is also responsible for helping me turn my wrist and also helping me bend the elbow. So if I want to take this muscle out of the play, all I have to do is drop my wrist. So I want you to do the same motion that you just did, but drop your wrist, keep your elbows in, and curl upward, just like this. And tell me if you feel a stronger contraction in your bicep. Do you feel that? The reason why is because I'm not activating my forearm anymore. So how do you do this at home? If you want to increase the load on your bicep and you want stronger looking arms, grab an orange, an apple, a can, a milk jug, whatever you want to do, a weight. You don't have to use heavy weights. You really, really don't. You can start with 1 pound if you want. Hold the wrist here and let it drop into extension. Keep the elbows tucked in and then curl up, squeeze, and then down. Okay? The bicep is extremely efficient at contracting. And as long as you eliminate accessory muscles, it takes care of itself. Okay? So we went to the front of the arm, the front of the arm, the back of the arm, and we actually eliminated the forearms. So now we're going to go to your shoulders. So shoulders have 3 heads. You have the anterior, the medial, and the posterior. Now, if we were to look at those muscles, which muscle do you think is neglected the most? The back one. So let's picture this. You're walking down a beach, and there's this beautiful guy coming toward you. He's got these enormous pecs. You can put pencils in the cliff of his chest. He's walking toward you. He's got these teeny little waist, huge legs, and he's just moving. He looks like a gorilla. He's just shining in the sun. You turn around and his back is flat as a pancake. Trust me, that guy's going to be a client of mine in about 3 weeks. Because what's going to happen is that he doesn't work his back muscles enough, and his upper back muscles I'm talking about. So what you're going to do with that is to hit those posterior delts, you're going to have to bring your hands up. Just like this. And you're going to flick your hands inward. So from that position, you're going to lead with your elbows and go toward your face. You should feel that those upper back muscles contract. Do you feel that? Now, if you don't feel it, lift your elbows a little higher. It's called a face row. And the reason why is I want you to envision that you have a rope right here and it's coming toward your face. You should feel those upper back muscles squeeze. So you should feel your shoulder blades contract toward each other. It's hitting the posterior deltoid and your rhomboids. Your rhomboids are the muscles that are in between your shoulder blades that attach to your spine. Those are also postural muscles. Those also help you when you're pressing upward. Okay? The trapezius is one of the strongest muscles as well. Those are those big lumpy muscles that they get on bodybuilders. I think they look pretty cool, but people don't like them. But anyways, so those muscles are elevators. So they're designed to elevate the shoulder. They also help lift the arms up. So to hit those muscles, you're going to have to do them 2 ways. You're going to have to roll the shoulder back and drop them down. Stay in this position. You should feel your chest muscle contract now. From that position, all you're going to say is, I don't know. Just like this. It's just a simple shrug. Now, the reason why that's important, because it's going to keep your body like this and not like this. Those muscles are designed to keep your body upright. It's designed to support your neck. How many people do you see that do this all day long? You don't want to look like that, because it's going to cause headaches and it's going to cause neck pain. Get your chin over your body again and help those muscles support those neck areas. Now, the trapezius muscle is a very strong muscle. It attaches from the base of your head to your shoulder. Now, for women, you don't wear, I hope you don't wear one. It goes to T7, which is where your broad line is. Okay? That's the 7th portion of that area for your back. So it's right there, T7 area. So it's coming back like a big triangle. It's a real beefy, strong muscle fiber. So to hit the second part of that tricep, or the trapezius muscle, you're going to put your hands here like this. Now this time, instead of coming straight up, you're going to come at an angle back. So think about your shoulders shoving back anglely this way, straight up. You're going to feel it in the trap, but just a little lower, just like that. And again, that's going to help you get your posture up. So I have a friend that I live with. I'm not sure if you know who he is. Sean Tilley, big guy, Samoan. He's my right-hand guy. He's one of my occupational therapists. He works out with me 5 days a week. Sean is incredibly, incredibly strong. Never worked his traps at all, ever. His posture was starting to get like this. He started to develop a Downinger hump. But if you see them now, it's not. His back looks wonderful. It's perfectly straight up and down. The reason why is because he's doing shrugs. We do shrugs literally every day, and we do face rows every day. The reason why is they're postural muscles, and they're really important to sustain. Since our jobs consist of either computer work, or always in front of us, or we're moving patients in front, we have a tendency to do this too much. So we got to pull ourselves back. So even at our age, we have to work those muscle fibers. So those are really, really important. Okay, so we actually went to the posterior delt and your trap. Now the side deltoid, this one's sort of tricky, because if you get impingement, if you do this wrong, even without weight, it's going to hurt. So the easiest way to do is always keep your hands in front, just like this. Now I want you to watch the angle that I'm at. My hands are right here, and they're going to stay at the same angle the entire time. I'm going to keep my thumbs facing upward, not inward, upward. So what I'm going to do is I'm going to come up like this. Now if you're doing this right, you should feel that upper back muscle contract. If you're not doing it right, you're not going to feel anything back there. So as I come up, I'm going to be squeezing that upper back muscle up. Now I want you guys to try something. I want you, when you're coming up this time, I want you to flick your hand down and tell me what happens. So drop your thumbs down and come up. Tell me where you feel it. That's right. Because another muscle, accessory muscle, is coming into play, and trust me, that humeral head, this bone right here, and here's the acromial shelf, so here's your clavicle like this, and here's that shelf, here's your humeral head. There's not much space there. There's about that much space to begin with. So as soon as I rotate my hand, I'm bringing my elbow in this way, I'm rotating the humeral head. So if I'm rotating that humeral head, guess what happens to the space? Now I'm lifting my arm up, clunk, I hit that shelf. Well, guess what travels right here? There's a nerve, and there's a tendon, and guess what? I keep doing it. I'm smashing the thing. So then about 3 days later, you're going, why is my arm going numb? Because you're not maintaining that position. So just by turning your hand, you're rotating that humeral head, you're opening up the space this much. So there's a surgery, it's called a subacromial decompression, where you have that ligament. Doctors go and they clip it, and it gives you a space to lift. So people that get that are impinging, it actually allows them to move that way. But then you've seen them before when you're in the pool, they have this funky little bump right here on both sides. It's because they've had that, or they've done it naturally by falling. So it actually opens up the spacing. You don't want that to happen because it's going to cause problems. Now, if that starts impinging the area, you think that the bone gets really nice and polishy? It's like barnacles, literally. The bone is perceiving that there's a load, so it starts building bone there, and it builds it like little spikes. So if it's building it like little spikes, what do you think it's doing to the tendon? It's just like getting a dull knife and rubbing it on a piece of meat. Eventually, it's going to slice right through it, okay? So you don't want that to happen. Like I said, the pain is terrible. You'll get headaches, neck pain, your arm will start getting weaker for no reason, and that's what's going to cause the problem. Anterior head, front of the muscle, this is the easiest muscle to hit. All you have to do is put your thumbs up, hands up to your side, and come up. Now, some people's philosophy is go all the way up. You don't have to. Remember, we're talking about that shelf. You just have to go to 90 degrees. That's all you're doing. That's it. Coming straight up. If you want, you can use a soup can in each hand. You can use one arm at a time, or you can do both arms at the same time. Okay? Those are all the muscles that you need to work to keep your body strong. How many sets are you doing? 5 of 5. We're keeping it simple. Everything's 5 of 5. Now, are you guys going to remember all this stuff? No. So Denise is going to draw all this stuff out to you and give it to you later on today. I'm joking. She's not. I'll draw the stuff out and I'll give it to Denise and she can give you guys copies. Okay? My drawings, and please forgive me, my drawings are all bald because I'm bald. And they're pretty much little stick figures. They actually look pretty cool. But I'll draw everything out and I'll put down 5 sets of 5 on all the exercises that we covered. Okay? I'll work on it probably this week and I'll get it to Denise sometime next week and she can make copies and pass them out to you guys. If you have any questions at all, you can call me at extension 3483. upstairs on the 6th floor. That's the easiest way to do it. If for some reason you can't get a hold of me, my staff will take a message and I'll get back to you guys. Any questions that I can help you guys with anything?
Thank you. Thank you so much.
Oh, it was my pleasure. And again, if you guys need any help with balance or you feel that you've actually gotten weaker, if you want to be placed on an exercise program, you can either tap into Denise and her staff or come to me and actually talk to me about it. Okay?